landmark. So this was about the muscles of the anterior aspect of pectoral girdle: pec major, pec minor, subclavius, and serratus anterior. It's technically not most anteriorly but on the medial wall, but we discussed it. Now let us talk about the clavipectoral fascia. If you dissect out the pec major, beneath it you will see this fascia, the clavipectoral fascia, running from the clavicle above down and to the axilla here. And let me show you here the pictures from the atlas. So this is clavipectoral fascia. Above it is starting from the undersurface of the clavicle right here. Below it is being inserted on the fascia of the axilla. And the medial aspect it is attached to the ribs right here. And lateral aspect it is again going to the axilla and the muscles there. It encloses two muscles within it. Here there is subclavius muscle and here there is pec minor muscle. These two muscles are embedded within the clavipectoral fascia. So as you can see, the fascia, two-layered fascia goes, splits, covers the subclavius muscle, then goes, splits and covers the pec minor muscle. So here is the picture that is like this. If you cut it like this and then see from this side, then you will get this picture. From the skin superficial fascia, deep fascia, you saw pec major, and when you removed it, you saw this clavipectoral fascia. So it is split to enclose subclavius under clavicle. Then there is a constant part. Then it splits again to enclose pec minor. Then goes down, and then it is attached here to the fascia of the axillary foot. And that is why when you put your in abducted position, your axilla goes into the concave shape because this fascia pulls up the fascia of the axilla. So depending upon due to the parts, depending upon the placement of the pec minor, it is divided into two parts. Then there is a part that is above the pec minor, this part. So this whole part is called costocoracoid membrane. Why? Because here is the coracoid process, it is attached to here, and through here it is attaching here to the rib number 1, 2 and 3. So this is costo costocoracoid part, and its part that is just beneath and parallel to the subclavius muscle, this part is thickened. So this is called costocoracoid ligament. This is the costocoracoid ligament. And then there is come the part that is beneath the pec minor all the way to axilla. So this part is called suspensory ligament of axilla because the fascia of the axilla is suspended through this. You are very frequently asked question: which structures are piercing the clavipectoral fascia? There are two structures going inwards, two structures going outwards. The inward going structures, one is very clearly shown, is this blue colored cephalic vein carrying the blood of the superficial of arm to the inside, and one thing that is not shown here is the lymphatics from the to the going to the apical group of nodes. Basically lymphatics accompanying cephalic vein. Things coming out is this artery. This is the thoracoacromial artery with had its four branches, three shown in this picture. This pectoral, deltoid, and acromial, and these branches supply this pectoral region. And then there is this nerve that is the lateral pectoral nerve on the way to the pec major muscle. So these structures are shown right here too. There is thoracoacromial artery, cephalic vein, and this lateral pectoral nerve. By the way, you must keep in mind that pec major is always supplied by both lateral and medial pectoral nerve. Pec minor is majorly supplied by medial pectoral nerve, sometimes by both, but majorly by medial pectoral nerve. So on the way to pec major, medial pectoral nerve passes through both, through the pec minor muscle on the way to pec major, and the lateral pectoral nerve goes through clavipectoral fascia to the muscle. So thank you so much for listening. I hope so this had been helpful for you. If you have any questions or feedback or suggestions regarding this lecture, please mention down in the comment, and you may reach us through our website By the way, all the recordings with presentation material is present there, and our Facebook and YouTube channel. Please feel free to reach out. If you have any queries and suggestions, please let me know. I will be trying to follow up with further lectures on the upper limb. Thank you so much.